So, and this is scary for a lot of people. It says these 5 states will be the first to kick residents off Medicaid starting in April. So this started yesterday. Let me enlarge this just to make sure. All right, kiddos. And their font is small. It says millions of Americans are at risk of losing their Medicaid coverage in coming months, but residents in Arizona, Arkansas, Idaho, New Hampshire, and South Dakota will be the first to bear the brunt of the terminations. States have been barred by Congress from winnowing their Medicaid rolls since the COVID-19 pandemic began. That prohibition ends on Saturday, and some states are moving much more swiftly than others to kick off those deemed ineligible for public health insurance program for low-income Americans. That worries advocates who say speed will result in eligible residents being incorrectly terminated. Also, it could hamper shifting those who no longer qualify to other types of coverage. Joan Alker says this is the fable of the tortoise and the hare. Taking time is absolutely going to result in a better outcome for eligible children and families to remain covered. So speed is a big concern. The states are rushing to get these people off the rolls, basically. It says the 5 states will start cutting off coverage in April, followed by 14 more states in May. By the way, my state's going to be one of the 14 in May. And 20 additional states plus the District of Columbia in June. All states must complete their redeterminations over the next 14 months. So it says Americans could start losing Medicaid coverage in April. So this is Arizona, Arkansas, Idaho, New Hampshire, and South Dakota. As you guys can see, actually, let me shrink this just a little bit so you guys can see the full map. Okay. So this is what's going to happen. So in April, it's those 5 states. Then in May, to 14 states. So as you can see, in June, it's going to be extended to those states, and then July, and then 1 state in October, which is Oregon. So this is going to be happening in the next few months. Okay. Enlarge this again so that people can see words clearly. Whoop. Hell. It's all right. I'll do it that way. Make sure. This is around 15 million people could be dropped from Medicaid, according to various estimates. Those 7 million folks could find coverage elsewhere. Others may still be eligible, but could be terminated for procedural reasons, such as not completing renewal forms. Those at risk include at least 6.7 million children. As Medicaid enrollment has ballooned since March 2020, when lawmakers passed the Families First Pandemic Response Act, I had to be careful what I say, which prevented states from involuntarily removing anyone from coverage. In exchange, Congress boosted states' federal Medicaid match rates by 6.2 percentage points. The provision was initially tied to a national public health emergency, but lawmakers changed that as part of the federal spending bill that passed in December. In addition to being able to start conducting terminations in April, states will receive an enhanced federal match through the rest of the year, though it will be phased down over time. More than 92 million Americans were enrolled in Medicaid in the Children's Health Insurance Program, also known as CHIP, in December, up 31% since February of 2020, according to the most recent data available for the Centers for Medicare and Medicaid Services, CMS. So this shows about children's Medicaid enrollment. Shrink this just a little bit. Shrink to the size of a lima bean. Charlie Sheen, Ben Vereen, shrink to the size of a lima bean. If you guys remember that from Pinky and the Brain. So it shows this is how many people were enrolled, and it shot up. So that's a lot of people. But that's a lot of people who received more health care. Right? So, and here's the thing that gets on my nerves. So, it says reviewing the eligibility of all those enrollees will be a monumental task for state Medicaid agencies, many of which are also contending with slim staffing. To gear up, they're hiring new employees, temporary workers, or contractors to bring back retirees, according to a recent survey conducted by Georgetown. So here's my problem with all this. And I have some notes. If we had a nationalized healthcare system, you would not have to worry about these monumental tasks for checking for eligibility. As soon as you're born, you're covered, and as soon as you die, you lose your coverage. It's just that easy. Capitalism makes things like healthcare more complex and difficult. Here's my question. If somebody's income increases, could it also be commensurate with the rising cost of living, which means that they're still in the same place economically as they were before? Having these states adjusted the index that measures financial eligibility, I'd argue that anyone in Florida making below $55,000 per year is low income and should be eligible for Medicaid, SNAP, housing assistance, etc. But that's not the way it is. It feels like they're keeping the same eligibility incomes, even though it costs more to live, and some are getting priced out of social services as well. Am I wrong here? Why do I say that? Well, let's go close to the end of this. Okay. Says not waiting for Medicaid expansion to begin. South Dakota will start terminating Medicaid enrollees in April. Though some low-income adults may become eligible again in July when the state's Medicaid expansion program begins. Voters approved the broadening of Medicaid to low-income adults in the ballot box in November over the objections of Republican governor and legislator. The 152,000 residents were enrolled in Medicaid in January, an increase of more than 30% from March 2020, according to the state's Department of Social Services. But more than 22,000 people appear to be ineligible currently. The agency said in a frequently asked questions that will prioritize reviewing folks who are most likely to be ineligible because they no longer meet a coverage group or their income has increased, among other reasons. This is why I'm asking what I'm asking. The problem is that when people okay, let's say hypothetically that you were working and you were eligible at that point in time, right? But then the pandemic started, and so you got automatic coverage. You cannot be kicked off the rolls, even if you somehow made a lot more money, right? But what happened over the pandemic? Inflation happened, price gouging happened, cost of living rose, right? So whereas you may have been able to get, along okay with $20 an hour, right? Let's say you were making $15 an hour, and then you got a raise bump up to $20 an hour, right? But now, because of the pandemic, because of the price gouging that we see, because of the inflation that has happened, $20 an hour is now equal to $15 an hour that we had months ago. But the government didn't adjust their eligibility requirements. So let's say you're still making that $20 an hour. Guess what? Now you're no longer eligible, even though your cost of living has went higher and you're now struggling. So there's a bunch of people that are getting kicked off these roles who still do need it. They still need it. But the problem is, the cost of living has exploded. See, when I was making $20 an hour a couple of years ago, as somebody would say, if I was making $20 an hour a couple of years ago, eggs were $2.50 for a dozen, right? Now you're making $20 an hour still, but eggs are $8 a dozen. What changed? People's housing has went up. Rent has went up more than a quarter, more than 25% in that short period of time. So yeah, we're getting more as far as pay, but our housing costs, our food costs, our education costs, all these things cost more. Our fuel costs for transportation. So yeah, of course people are making more, but they're not making more. Right? So my thing is like, am I wrong? Like, why are these governments taking them off the rolls when in reality they shouldn't be taking them off the rolls? Because as far as the ratio, they're still up the shit creek without a paddle. That's the problem. And on top of it, you have all these people who need healthcare. They need healthcare. And the thing is, you're just going to kick them off. All because they said, well, the pandemic is over. So guess what? Yeah, you guys don't need it. And then on top of it, the problem is some people who do still need it, who are still at the poverty line, guess what? They are going to get kicked off because they may have didn't re-enroll or something like that. Maybe they didn't think they had to re-enroll. And so it puts risk of people like me who are disabled of getting kicked off of Medicaid. How many people may risk getting kicked off? This is why I don't even say Medicare for all anymore. I don't say Medicare for all anymore. I say full nationalization of our healthcare system. Full nationalization. Because that's what we need in this country. We do not need to sit here and go, well, the people who make more, they should just have their own private. No. Private insurance should not exist in this country. It should not exist. Come for me if you want to, but it should not exist. They are a middleman that actually determines some people's health outcomes. And most of the times, it's not good. They will sit there and they will diagnose you and say, oh, well, you don't really need this test. You don't really need this procedure because we don't think that you do. And then you end up dead. Because they didn't want to pay it out, even though you've been paying into it. And that's the problem with this healthcare system. They are a middleman keeping you in between you and your doctor. They should not exist. They're literally reaching into your health, into your body and saying, this is what you need and this is what you don't. When in reality, That conversation needs to be happening between you and your doctor. And so something like Medicaid, which is moderately helpful for those of us who are near the poverty line or at the poverty line, or some of us that can't afford private insurance, but we make too much to have public insurance. Some of those people were held up by public insurance for a little while. Now they're going to be losing it, and they're going to be stuck in limbo because they make too much to afford one and they don't make enough to afford the other. And so guess what? Now you're going to have a whole bunch of people who are going to be stuck without health care, and now they are going to be screwed. And y'all wonder why. You wonder why we talk about we need to nationalize the healthcare system. And it is not an issue of individuals not being responsible enough. Get that bullshit out of your head. It is a systemic problem that requires a systemic solution. So you do not sit there and blame it on the individual, because guess what? It needs to be corrected on a system-wide scale. And so when we talk about, oh, well, people just don't make enough, so they need to be on Medicaid. No. Stop with the whole means testing crap. Means testing, all it does is put us in a situation where you have tiers within our economic system, within our medical system. That's what it is. The poor people are on Medicaid. The old people and some of the disabled people are on Medicare, right? But guess what? You're screwing everybody else that's on private insurance. And so now you're basically leaving them to the wolves. So now they either have to, if they are ineligible for Medicaid, then guess what? You're leaving them open to these leeches, to these jackals, these hyenas, these vultures, that are private insurance. And then they will get scalped every single month, every single paycheck, just to have some modicum of healthcare, while still being denied by these same companies. And you are one sickness, one virus, one accident away from winding up in the hospital. And then guess what? They're going to deny you care. They're going to deny you because they want to keep that money. They don't want to pay it out, because guess what? All they want is what's inside your wallet. And when you get sick and you really need them to pay that money out, they're going to be like, new phone, who this? That's how insurance companies operate. It is for profit. That's why the profit motive needs to be out of the medical system, period. And that includes pharma, medical device manufacturers, gyms. Yes, I'm coming for them too. Gyms should not be for profit. Put that in your pipe and smoke it. Welcome to RBN. Have you subscribed yet? Have you liked yet? Nursing homes should not be for profit. Spas should not be for profit. Yes, if it has to do with your health overall, it should not be for profit. Absolutely not. Hell no. Nah. Do not pass go. Do not collect $200. That's the thing. And the problem is that people will say, well, you guys are going to be subjecting the doctors and nurses to slavery. They're going to be working for pennies. Absolutely not. Ask doctors and nurses in the UK if they are slaves. Go ahead. They can be paid well and they can have a great living. In fact, I will be the first to say, make sure our doctors and specialists, nurses, nurse practitioners, techs, and everybody who works in the hospital, including the cleaning crews, because they're the ones that keep us from these infections, that they are paid well. I'd rather my taxes go to pay these people so that they're paid well. Pay people enough to take the issue of money off the table. And then, guess what? Their incentives is that we need them less. Preventative care. Make publicly owned gyms accessible to all. Have neighborhood dietitians that focus on our health, that focus on community gardens, that make the proceeds from community gardens free and accessible to people. But the problem is, it doesn't make profit. And I just went on one of my rants. But the thing is that this is the problem with having a means-tested system like Medicaid. But even still, it still moderately helps many people, and people should not be kicked off the rolls. So now you're subjecting them from a not so great situation by being on Medicaid, because Medicaid doesn't cover everything, to a point where they are screwed even more. So let me show this video really quick. And this actually kind of gives us more. Oh, nope. And it talks about the Medicaid deadline. And not a lot of people are talking about this internationally. Like, I found one that talked about it internationally on PBS, by the way. But the problem is like news organizations like PBS and CBS will copyright strike if you show their videos on YouTube, like this, which is crazy because PBS literally stands for Public Broadcasting Station, and you can't show it. And then they'll copyright you. I'm like, why in the hell are they public broadcasting, but then they copyright you? Isn't it in the name, public broadcasting? But I digress. That gets on my nerves. Anywho, let's go.
Welcome back, Medicaid recipients. You can consider this a last call to make sure that you're enrolled and to receive your benefits. Based on a new federal law, continuous Medicaid eligibility will end tomorrow.
Yeah, that's right. And that means in a couple of days in April, the state of Texas will begin removing people who no longer qualify. So to make sure you're covered, I spoke with the Coastal Bend Food Bank today for more information. Take a look. You might want to check your mail if you don't do so regularly. The state has been reminding Medicaid recipients to renew their benefits, or they could be asking them to provide more information to keep them on the National Health Insurance Program. Angela Gonzalez is the social services lead for the Coastal Bend Food Bank, and she helps people apply for community resources. She said some of her clients weren't aware that they needed to update their Medicaid information to ensure their coverage.
They were shocked, like, well, they haven't asked me for anything for years, because it's just automatically renewing.
That's because of the pandemic. The federal government declared a public health emergency and relaxed Medicaid rules to allow more people to stay on that program. But as the public health emergency comes to an end, so does continuous eligibility. For the first time in 3 years, many Texans who received the health insurance will have to requalify and renew by Friday, March 31st. According to state data, the number of people using the healthcare program has grown by about 2 million in the Lone Star State.
It's important because it takes the load off of them financially. So if anyone is low income and can qualify for Medicaid, they should definitely apply.
As case navigators, Gonzalez and her partner at the Social Services Department can help with that and even show you other community resources you may need.
We're really good about telling them what they need to help them get approved or to keep their benefits coming by helping them do that renewal.
All right, listen up. If you do need help, you can call the Coastal Bend Food Bank at 887-6291 and get connected with the Social Services Department. You can also renew or check your availability online. And to do that, visit our website for more information, christv.com.
People are suffering. And this is just not fair. All because there's this ideology that thinks that you have to pull yourself up by your bootstraps. And that the only thing that matters is individual responsibility. When in reality, nobody wants to talk about community responsibility. And it really just pisses me off, the fact that people are continuously suffering. And then they even get just a small crumbs of something that will help them. And then it gets ripped away from them. And then even if we were to get out in the streets, we would get our heads bashed in by the police because they don't want people to have what they are worthy of: healthcare, housing, food, a good education, a healthy environment. But they don't want you to have that. It's just work, work, work. It's this robotization, this mechanization of human beings for the sole purpose of profit. This is why they want to increase the use of AI in order to create profit. This is why they want to increase the use of automation for profit, because robots don't need healthcare. Robots don't need time off. Robots don't need a work-life balance. See, they've been trying to roboticize you, a worker, by giving you less pay, less benefits, less time off, because that's what they want to get out of you. But then they don't have to pay for you at all, or very little, except for operation costs, if they get robots. We live in a failed state. That's for certain. This is why I would love to see more mutual aid groups, especially ones that focus on more small time medical care, like, clinics and things like that help people. It can't do the same work as a hospital, but at least if, there's some things that can be more preventative for people and help in some situations, almost like a kind of like an urgent care type of situation, that would be feasible for the people. By the way, Rome is finishing building the library. He's doing a last ditch fundraising. So if you guys have not yet, or if you guys wish to donate, just $ Tour for the Poor on Cash App. You guys can go there. That's the first thing I can think of. But yeah, I think we really need something better, because you're worthy of it. So that's what's going on. So those of you who are on Medicaid right now, who are receiving Medicaid, make sure to check to see if you're still eligible. If there was a letter or a notice that you need to reapply today so that goes in tomorrow. Reapply. Check in on your elderly. Well, if they're elderly, they're probably getting Medicare, so they might be okay. But if they're close to elderly, but they haven't gotten to that point, like, I'll put it this way: if they're under 65, check on your people. If you have people in your life that are low income, check on them to make sure that they're still enrolled, that they're still eligible. If you know people who are disabled, check in on them. Just make sure people around you are okay, because there are people who are going to fall by the wayside in this. Millions of people. Yeah. Check on them.